And so now I have the pleasure of introducing our today's speakers for our feature presentation. I'd like to introduce today to you Dr. Joy Ogunsile. Dr. Ogunsile completed her fellowship at Johns Hopkins University, and she did her bachelor's in biology with a minor in African American Studies from Duke University, and then served as a research assistant at the National Institute of Health, National Institute of Alcohol Abuse and Alcohol Abuse and Alcoholism. She completed her MD from the University of North Carolina, Chapel Hill, and her residency in internal medicine and pediatrics from Vanderbilt University Hospital. Dr. Ogunsile's clinical interests are in the care of patients with sickle cell disease and non-malignant hematological disorders. As a physician scientist, her research interests are to improve therapeutic decision-making and outcomes for patients with sickle cell disease, with a current focus on understanding the factors that influence cardiovascular outcomes, body composition, and physical activity in patients with sickle cell disease. And so with that, I'll turn it over to you, Dr. Joy Ogunsile.
Hello, everyone. Thank you guys for giving me the opportunity to speak to you guys on some of my research interests and to answer questions about physical activity and exercise and sickle cell disease. Next slide. These are my disclosures, and none of these disclosures are relevant to what we will be discussing today. Next slide. So today we'll kind of go over the history of physical activity and exercise studies in sickle cell disease, then really talk about why exercise can be important for sickle cell disease, and lastly end on important issues to address and future studies on the horizon. So before we begin with our discussion, it's really important that we define the terms physical activity, exercise, and physical fitness. These terms are often used interchangeably, but they're not the same thing, though they are related. So physical activity is defined as any bodily movement produced by skeletal muscles that results in energy expended. Physical activity can be categorized as occupational, sports, conditioning, household, or other activities. So anything that we do throughout the day that expends calories, basically. Exercise is a form of physical activity that is planned, structured, and repetitive with the goal of improving your physical fitness. And then lastly, physical fitness refers to your overall state of health, your overall well-being. A lot of times in the medical side of things, we always assess how fit a patient would be for certain procedures and certain things of that nature. So fitness is more of a state of health. So what's shown here in the diagram is that exercise, as you can see, is kind of a subset of physical activity, and both of these things can improve your physical fitness. And if you have a higher physical fitness level, it makes it easier for you to do physical activity. Next slide. But another thing to think about physical fitness is its role in cardiovascular morbidity and mortality. It is directly associated with cardiovascular outcomes and long-term survival in the general population. And this is a really good graph showing that the higher your fitness level is, the lower mortality that you are suspected to have over time. And the reason why physical fitness is, I believe, a good predictor of cardiovascular health is because it really does give us a great idea of how your organ systems are working together for you to perform an activity. And that comes a lot of how we measure physical fitness. So it's a measurable parameter that can be translated throughout many studies. Another thing about physical fitness is that there's kind of two levels to it. You have your health-related variables, which are things that can improve your overall physical health, and the things that we are particularly focused on when we think about medical research and just research in general for physical fitness. So that includes cardiorespiratory endurance, flexibility, muscular endurance, power, and strength. And then there's skill-related physical fitness, which mainly is kind of focused on improving one skill so that you can increase your level of performance. So this is primarily has to do with athletes and things of that nature who are trying to perform at a higher level. But in terms of what we do for research, we focus mainly on the health-related variables. Next slide. So here are some examples of how we can measure physical fitness. So we do this through exercise testing. So on the left, we have muscular strength testing, and this is a Biodex 3 machine. And what we're measuring here is torque, but you can also do other tests, hand grip tests, have patients jump, and things of that nature to measure the work and power output too as well. And then cardiopulmonary exercise testing is where we're really assessing a patient's aerobic capacity. So patients are either bicycling on the bike or walking on a treadmill for us to get their level of aerobic capacity. A measure that we usually use is called peak VO2 or VO2 max, and that refers to the maximum oxygen consumption that is used at peak aerobic capacity. And this is a variable that is used very commonly in exercise literature and just even medical health literature. So the higher your VO2 max is, or peak VO2, the higher your fitness level is. There are other variables that we can use to translate fitness as well, but it's primarily peak VO2 and VO2 max. And then with flexibility, some studies are focusing on that, and mainly we're looking to see how flexible you are with degrees. Next slide. So how can physical fitness be important in sickle cell disease? I think to think about the context of sickle cell disease would be helpful here. We know that a leading cause of death in adults with sickle cell disease is cardiopulmonary disease. And shown here is a table taken from Dr. Fitzhugh and colleagues while she was at Duke University, looking at autopsy reports of patients that were living versus those who had died with sickle cell disease. And we saw that the cardiopulmonary complications were mainly found in patients that were deceased. So it is a leading cause of mortality in our patient population, but unfortunately limited treatment options exist to prevent, modify, and treat cardiopulmonary disease for adults with sickle cell disease at this point. Next slide. So just thinking about how cardiopulmonary disease is a leading cause of death in sickle cell disease, and thinking of ways that we could potentially change this outside of the disease itself. We know that sickle cell is a hemolytic disease that can cause endothelial dysfunction and inflammation that probably contributes to what we're seeing primarily. But I had a question of whether or not traditional cardiovascular risk factors, things such as dyslipidemia, hypertension, diabetes, could also be something that we should be thinking about too as well. If we look at obesity or BMI throughout over the last 2 decades in the US, we see that BMI has increased quite significantly for the US population overall. Next slide. And now that patients with sickle cell disease are living longer, one of the questions I had is, what is the prevalence of metabolic or cardiovascular risk factors in adults with sickle cell disease? I will say that, traditionally, studies have shown that our patients were underweight and that they actually had a low prevalence of these traditional cardiovascular risk factors. But I think it still begs the question of seeing whether or not what our patients are mirroring what we're seeing in the general population. So next slide. And what we saw is that it's quite possible, looking at a study that we did in Baltimore, that our patients are adopting a lot of the lifestyle practices in the US of A as it is, and it is causing some effects in terms of their cardiovascular risk. So this was a study of about 49 adult patients with sickle cell disease, and we were with the goal of assessing whether or not they fulfill criteria for metabolic syndrome. So as you see here, 14% of our population fulfill criteria of metabolic syndrome, and they fulfill it mainly based on 3 of the risk factors that are listed here. So that was waist circumference, having a lower HDL level, and having high blood pressure. Next slide. And then when we look at other unhealthy patterns that could confer higher cardiovascular risk in our patient population, we saw that there were some things that our patients are doing that could portend a higher risk. So 18.4% of the small cohort were currently smoking. 66% of our patients were inactive according to the national guidelines. And then we saw that our patients were eating unhealthily too as well. There was a large amount of dietary fat, oils and sweets, as well as a large percentage of their total kilocalories from fat was higher in this population too as well. Next slide. So to sum it all up, 14.3% of adults we found had metabolic syndrome in this patient cohort, hemoglobin SC patients, much more so than hemoglobin SS. And though this prevalence is much lower than what is found in African Americans in the US, I believe in African Americans about 21 to 25%. I think the fact that we found this at all really speaks volume to our changing population, especially as our population ages. Again, our population, 66% of our cohort did not meet national guidelines for activity. 18% of our adults were smoking, and then there was a large amount of dietary fat and sugar consumed. And unlike what has been reported and has been seen in our patient population in the past of being underweight, none of our patients were underweight. In fact, about 50% of our patients were either overweight or obese. Next slide. Furthermore, I think highlighting the prevalence of cardiovascular risk in our patient population is the study that was recently published by researchers at the NIH. Using machine learning technology, they were able to create a predictive mortality score based on key clinical, laboratory, and imaging data that they thought would confer the most risk based on machine learning of mortality. And out of 600 patients from their cohort, again, they saw that a third of their cohort were obese or overweight. And what's even more interesting is that having a higher BMI of greater than 35 predicted worse survival. And I think the fact that they saw patients with a BMI greater than 35, again, what we saw in our cohort too, really speaks volumes to the fact that in terms of cardiovascular risk and traditional cardiovascular risk factors, our patient population is changing. Next slide. Next slide. So, you know, I brought up fitness and what is the role of fitness in sickle cell disease? I think the first question that we need to ask ourselves is, what are physical fitness levels in sickle cell disease? Since I said this is something that we can measure. So working with Dr. Lanscombe again during fellowship, we looked at 29 patients with sickle cell disease, and they underwent the exercise testing that I had discussed earlier. The main variables that we were looking at for cardiopulmonary exercise testing was peak VO2, and then for muscular strength testing, we were measuring torque. And we compared our exercise testing to a healthy adult population. Next slide. So what we found was that there were lower values of peak VO2 or cardiovascular fitness in adults with sickle cell disease. So this is compared by genotype. So looking at VO2 max and for our patients with sickle cell anemia versus sickle cell variant syndromes, mainly hemoglobin SC in this case, they were not statistically different. However, when we compare our values to the national values for VO2 max for both female and male participants, our levels that we found in our patients were significantly reduced to what should have been expected based on their age. So next slide, there's multiple. Yeah, so this just shows a VO2 max. If you can click again. And this here just kind of shows the values for men and women based on age. Click one more time. Yeah, I don't know if this is gonna let you advance anymore. There we go. And there we go, thank you. And now, in looking at muscle strength in our population too, we saw that similar to what we saw for peak VO2, muscular strength was significantly reduced in our patient population compared to our control group. Our control group was about 60 patients, relatively healthy, aged between 20 and 40. And we saw for both females and males that muscular strength was reduced about close to 50%. And this was statistically significant. Next slide. So, you know, we were able to show that physical fitness levels was reduced in sickle cell disease, but there have been other studies that have reported the same thing. Dr. Liam in Chicago showed that peak VO2 was approximately 30% lower in children with sickle cell anemia when compared with controls, even after adjusting for BMI and hemoglobin. Van Beers and colleagues show that 80% of adults with sickle cell disease had evidence of decreased maximum exercise capacity. And then there was a study of adult females with sickle cell disease who underwent cardiopulmonary exercise testing, and they also had lower fitness levels, exemplified by having lower peak VO2 and other variables of physical fitness, such as lower anaerobic thresholds and lower work weights. And muscle strength too has been reported to be lower in adults and children with sickle cell disease. So physical fitness levels in sickle cell disease are lower. Next slide. But what does this mean? For us to really answer this question, that would require a longitudinal study where we're assessing fitness and seeing how people do in terms of clinical outcomes and mortality. And that's not available to us now. So whether or not physical fitness portends the same cardiovascular risk and cardiovascular outcome as it does in the general population, we don't know that at this point. However, I did try to see whether or not physical fitness levels corresponded with cardiovascular risk using the Framingham risk scores, which right now is largely outdated, but bear with me for purposes of this illustration. So looking at patients in low and high fitness groups, we saw that patients who had lower fitness, exemplified by having lower muscle strength, this was associated with higher cardiovascular risk scores. Next slide. Also looking at Charleston Comorbidity Index, our predicted survival scores in physical fitness, we saw that over time, patients who had lower fitness had lower predicted survival scores over time. So it's hard to say, and I hope that future studies will really elucidate whether or not this role is the same. In terms of physical fitness, predicting cardiovascular outcomes and cardiovascular mortality in adults with sickle cell disease. I don't foresee any reason why it would be different, but of course, research is what we need in these times. Next slide. Next slide. So what are some of the reasons behind having low fitness in sickle cell disease? And it's multifactorial. The reasons that have been reported and suggested just based on the cardiopulmonary exercise testing that we have done was cardiopulmonary disease, which we know occurs in sickle cell disease, physical deconditioning, myopathy, peripheral vascular disease, and anemia. Out of all of these reasons, physical deconditioning is something that we could potentially modify. Next slide. So, you know, if patients are physically deconditioned, you know, the question is, what are physical activity levels currently in sickle cell disease? And there's been about 4 studies reporting physical activity levels in adults and children. To start off with children, we see that physical activity levels are reduced compared to control populations. So fewer children reported vigorous or moderate physical activity compared to controls. And then when we have our children wear accelerometry for a week, we saw that their total steps and total calorie expenditure that were expended was lower in children with sickle cell disease compared to controls. And we saw something similar in our adult population in Baltimore and also our population here at UAB, where only a minority, about 20%, 40% in Baltimore, were meeting guidelines for physical activity. And some of the barriers that were reported in children for reduced physical activity levels were pain impact, disease interference, and also just providers discouraging exercise. Next slide. And when we looked at predictors of physical activity in our UAB sickle cell disease cohort, we saw that, interestingly, gender was a predictor of physical activity in our cohort. More males reported that they were completing optimum levels of activity compared to females. And then also what was interesting is that we didn't see a statistical significant difference between whether or not you had sickle cell anemia, hemoglobin SS, or hemoglobin SC. Lastly, looking at barriers, out of all the barriers that we assess, lack of time, social influences, lack of willpower, fear of injury, lack of skill, and lack of energy, we saw that lack of energy was a statistically significant barrier between the optimum and subadequate group, where patients that were in the subadequate group were more likely to report that they had lower energy than those in the optimum group. Next slide. We also tried to assess some facilitators of physical activity and whether or not certain things like the sickle cell self-efficacy scale would predict higher physical activity, whether or not their beliefs predicted it, or planning. And we saw that there was no difference between the three groups of these facilitators. Next slide. But we did see that using short-term pain medications was statistically significant statistically different between the three groups. Patients who were participating at an optimum level of physical activity were more likely to use short-term pain medications. But we did not see that there was any difference using long-term pain medication or any difference in their hospital admission rate or whether or not they were on disease-modifying therapy. So this was all interesting. So I say all of this to say that I think exercise is a potential therapeutic option for sickle cell disease. We know that physical fitness levels are low in patients with sickle cell disease. We know that physical activity levels are low and that a lot of our patients are deconditioned, from largely living sedentary lifestyles. Patients are always in and out of the hospitals, staying in the hospital for about 5 to 14 days. There's a lot of pain that can probably prevent them from being as active as they would like. So thinking about this, I think that exercise is something that we should think about in terms of improving patients' physical fitness. Physical activity and exercise has been great in other conditions such as cardiovascular disease, diabetes, COPD, cancer, rheumatoid arthritis, and osteoporosis. And then when we look at exercise at the biochemical level, we see that it can enhance your metabolic profiles, it can improve autonomic tone, it reduces systemic inflammation, decreases blood coagulation, improve oxygen efficiency, improve coronary blood flow and cardiac function, and enhance endothelial function. And overall can really improve daily functioning, quality of life, and mood. All great things for sickle cell disease when we're especially thinking about the pathophysiology. And there has been studies of exercise in sickle cell disease. To date, there's probably about 5 studies that actually looked at exercise programs in sickle cell disease, so regular exercise. This was the first study to be published, and it was published by our colleagues in France, where they randomized adults with sickle cell disease to the intervention group and the control group. And those in the intervention group participate in 8 weeks of exercise. They were asked to do aerobic exercise on the bike for about 30 to 45 minutes, about 3 times a week versus controls. And at the end of the exercise program, they saw a lot of great benefits of exercise. Number one, all of the patients were able to complete the exercise program safely without having any adverse cardiovascular events or having an increase in their baseline crisis levels. And then lastly, they saw that exercising actually increased their fitness. So they were able to modify their fitness by exercising. And it also increased their capillary network in their muscles. And this resulted in partially reversing microvascular damage too as well. So this again speaks to the therapeutic effect that we could see with exercise. There's other studies in sickle cell disease that show after exercise that we can decrease red blood cell aggregation, increase nitric oxide levels, and also just reduce inflammation. So, and when we asked our patient population here at UAB whether or not they think exercise would be helpful, patients responded in general, yes, that they felt this would be very helpful. They either talked about previous experiences or what they believe exercise could be for them. And most of them thought that it would be helpful because it could improve their general health, survival, immune system. It can improve their cardiovascular system. Many patients spoke of having better blood flow and oxygen delivery. It could ameliorate pain and reduce mental and stress relief benefits too as well. Next slide. But unfortunately, there's still barriers to overcome when we think about exercise. Number one, we really don't have any national guidelines at this point. We do not have national guidelines. And there isn't an exercise prescription or exercise recommendations that providers can tell patients with sickle cell disease when it comes to exercise. And I think a lot of this has to do with just that there's just lack of evidence so far. Even though we have about 4 or 5 trials of exercise programs in sickle cell in patients with sickle cell disease, we only have 1 RCT, a pilot, and 2 prospective studies, with the largest N being of 60. So this is something that we have to overcome in terms of studying this more extensively. Another thing is that there are a lot of concerns of adverse events occurring from exercise in sickle cell disease among providers, among patients, and among the medical community at large. And I think a lot of this stems from what we have seen with sickle cell trait and college athletes, where patients were collapsing, people with sickle cell trait, not sickle cell disease, were collapsing on the field after high exertion. And a lot of people thought that, oh, this was because of their sickle cell trait. However, you know, a lot of those claims have been substantiated because what we found to be more important than whether or not someone has sickle cell trait was whether or not people were practicing good exercise practices, such as drinking enough water, taking breaks when needed, and not overdoing it. Next slide. And when we looked at barriers to exercise in our cohort here, we saw that the top 3 barriers were pain, poor fitness level, and fatigue. Next slide. And in our free text responses, we saw that 28% of responses were either unsure or had negative experiences. And some of the negative experiences did have to stem with the fear of pain and personally having accounts of it throwing them into crisis. Next slide. But I will say overall, though we have to be very careful when we think about exercise and sickle cell disease, when we look at the studies, moderate intensity exercise and exercise testing seems to be very safe in our patient population. So Dr. Liam and colleagues, they assessed the safety outcomes of cardiopulmonary exercise testing in children and adults with sickle cell disease, and they were doing maximum cardiopulmonary exercise testing. And out of 24 studies and 939 patients who fulfilled criteria, only 3.8% reported adverse events with maximum exercise testing of transient ischemic findings on ECG or oxygen desaturation during testing. And only 0.43% experienced pain events such as vaso-occlusive episodes with maximum exercise testing. Next slide. So, largely the studies have shown, overwhelmingly the studies have shown that moderate exercise Moderate intensity exercise appears very safe. We haven't looked at high intensity exercise that extensively yet in sickle cell disease. So right now, I believe that high intensity exercise is not recommended, but moderate intensity exercise does appear safe. And when we're thinking about exercise in the future, it is important that we have a careful approach to designing an exercise program in adults with sickle cell disease, really taking their disease pathology into the picture too as well. We know that patients with sickle cell disease have abnormal exercises responses to exercise testing, and that is displayed as having steeper rise in heart rate, gas exchange abnormalities, higher lactate levels, and lower anaerobic thresholds. We also see that individuals with sickle cell disease may not have good self-regulation strategies, so they often exercise to severe fatigue and can't overdo it. And this graph here is a good illustration of some of the abnormal exercise responses that we see in patients with sickle cell disease. So on the y-axis is lactate, on the x-axis is time, and the black circles represent a patient with sickle cell disease, and the white circles represent a normal patient, and the gray circles represent an athlete. And what we can see is that our patients with sickle cell disease reach their lactate threshold much earlier than patients that are normal, and definitely much earlier than a trained athlete. So things that we have to think about when we're thinking about exercise in adults with sickle cell disease. Next slide. And there is a study underway currently called the Sickle Cell Pro-Inflammatory Response to Interferon Testing Study, or SPRINTS. And this is, again, really determining the impact of exercise on acute phase inflammatory responses and changes in airway dynamics. And what the study is really getting at is what dose and intensity of exercise is going to be okay for our patients and not cause any crisis or damage. We know that moderate intensity for the most part, for the majority of the part, is safe, but is really kind of investigating this more closely. During acute exercise, there are release of cytokines, myokines, and you can have oxidative species that are flowing around. So really understanding what this looks like in sickle cell disease is important, and I'm happy that this study is underway, and hopefully one day we can report on these results. Okay. But for right now, again, I keep on saying that moderate intensity exercise appears safe, but it's important to have safety measures such as hydration, frequent breaks, active recovery. I really think it's important for patients to participate in recovery when they're exercising. There was one small study that I had read that showed that patients who actively cooled down, their inflammatory cytokines were much lower than patients who did not. So that's really important for our patients with sickle cell disease to include that when they're exercising. And then this last thing that I wanted to talk about was lactate levels and heart rate. So the randomized control trial that we have of exercise completed with our French group, they did that safely. There was no vaso-occlusive crisis that occurred, but they were measuring lactate levels throughout, I think maybe every 5 to 10 minutes while the patient was actively exercising. And they were using lactate levels as a measure of safety, so that if a patient's lactate level got too high, they would tell them to reduce their intensity at that time. So very good to do, measuring lactate levels in kind of the supervised exercise center environment, but you know, the question is down the line, how can we translate that to the outpatient setting? So what's shown here is a study that tried to answer this question. I think they did a very good job. So on the y-axis is lactate, and on the x-axis is heart rate. And this was about 15 patients with sickle cell disease, and they looked at their response during cardiopulmonary exercise testing and see whether or not their lactate levels corresponded to heart rate, and seeing whether or not we can use heart rate as a measure for our patients who are exercising in the outpatient setting as to control their intensity. So I thought that was this was a very interesting paper. Go for it. Oh, wow, this formatted really horribly, but this is a brochure that we give our patients at UAB for who are participating in our exercise programs, really just kind of explaining the benefits of exercise for people with chronic conditions, giving them 2 main studies of exercise. And I think what's most beneficial for our patients is understanding the difference between moderate and vigorous activity levels. When I talk to my patients, I always try to tell them about the talk test, which the CDC has reported very nicely good things about on their website. But basically, for moderate activity, you should be breathing hard, but you can still have a conversation. Whereas vigorous activity, you can only say a few words. So we really want to keep them at the moderate activity level. And things that are moderate activity or like kind of like brisk walking. I would actually include jogging for some of our patients in moderate activity, cycling, gardening, and things of that nature. Next slide. And if you guys have any questions about the physical activity and exercise studies that we're doing here at UAB, we have coined these studies as SCD Fit, which is Fitness Intervention Trials in Sickle Cell Disease. Please feel free to email me or if you have any questions at all about this presentation. Next slide. So when we think about future directions, I think over the years we've had more and more exercise studies, especially in the last 5 years, I would say, that shows that patients are able to complete moderate intensity activity safely. But there needs to be more studies addressing the acute inflammatory response to exercise in sickle cell disease patients. We still need to come up with an exercise prescription that is tailored for our patients with sickle cell disease. And it'll be interesting to really define the clinical benefits and see whether or not we can use this as a therapeutic tool, especially thinking about the cardiovascular disease, physical functioning, pain, mood, and so forth. And then lastly, making a program sustainable. I think everyone knows exercise is great in the US, but a lot of people are not doing it. So again, we will have to make sure that really including behavioral interventions and making sure that it is adapted to our population, something that we have to think about too as well. Next slide. So in conclusion, physical fitness is an important indicator of cardiovascular health in the general population. We don't know the role of physical fitness yet in sickle cell disease, and I do hope future studies will help to elucidate this role more clearly. As a population of patients with sickle cell disease age in a sedentary and Western-based culture, there's increasing prevalence of traditional cardiovascular risk factors that can be modifiable, such as physical inactivity. It appears that moderate intensity exercise is safe, and we need to do more work to understand barriers, facilitators, and attitudes, since this will help with the sustainability of exercise. Next slide. I just want to acknowledge my mentors. I want to acknowledge the patients with sickle cell disease and people living with sickle cell disease for giving me the opportunity to improve their lives through research. Next slide. And I am now open for questions.
Sure. Thank you so much, Dr. Joy. That presentation is extremely informative. And so at this time, we will take questions. And just as a reminder, we take our questions through the written chat box or question function on the control panel feature of this webinar. I will open it over to Susan. Do you see any questions coming in?
I do. There are a couple of questions coming in, and I want to, before I jump into those, I want to, again, as you just did, Niani, encourage folks to put questions into the question box on the right side. And I'm going to take the privilege of having the mic and ask a couple of questions first. It was a fantastic presentation. Made even more so by every time I wrote down a question to ask you, you then answered it on the next slide. So that was extremely helpful. One of the questions that I had was around the relationship between not so much crisis pain or severe crisis pain, but the pain that people living with sickle cell disease experience every day. I imagine, and you referred to it as well, that that is somewhat of a barrier for folks in engaging in exercise and fitness activities. But I wondered if there was evidence that doing so might reduce that some of that chronic pain that goes on. You mentioned a few other things that it definitely does appear to impact, but I wondered if that was something that had come up.
Yeah, that's a very great question. And the answer is yes, exercise can reduce chronic pain, but unfortunately, for some people, exercise can make it worse. What I've seen here for our exercise colleagues is, again, thinking about the dose of exercise and what exercise patients with chronic pain are more apt to do that would not actually increase their pain. And a lot of that is just low intensity and resistance training and gradually increasing your intensity if needed. So that's one of the things that they have seen here in terms of addressing patients with chronic pain into exercising. If you overdo it, of course, it's going to make your pain worse, but really kind of educating patients over a lower level of exercise, intensity exercise is most helpful.
Thank you. Neely, I'm going to ask if you could back up the slides to Dr. Ogun, and help me if I'm pronouncing it wrong, Ogunsile, her email address, because a couple people asked for that. Thank you. I'm going to more question, and then we'll jump into the many questions that are appearing here. So one of the slides, you mentioned that a lack of energy was associated with less physical activity, and it's kind of a similar question to the one I had about pain. What is the relationship there? And or I guess I'm asking which way the causal arrow goes. So are people who do engage in a regular exercise program then more likely to have higher energy, or is there some kind of foundational organ, lung damage that is causing that low energy and also making it very hard to exercise?
Another good question. I think we're going to have to do more studying into seeing whether or not there's other factors that can contribute to having a lower energy between the optimum and subadequate group. I think you mentioned, organ damage, the severity of their sickle cell disease is something that we would have to take into account. Right now, it's really hard for us to understand the direction because it can be a chicken versus the egg thing. So we don't know right now which way that relationship would go. We just know that it's a finding that we found that was associated between the optimum and subadequate group. But I can see it going both ways.
Yeah. Okay. Oh, sorry. Go ahead.
I guess the only other thing that I would say is that the percentage of patients that were not treated with sickle cell disease, meaning they were not prescribed disease modifying therapy, was the same between the two groups. And again, that can mean two different things. It can mean that the patients in population were in severe where they needed it, or the patients were in a population they were severe enough. So I do think that because the disease modifying therapy percentage between the two groups is the same, that probably speaks to activity causing more energy for our patients. But again, we would just have to look at that more closely.
Okay, that's really helpful. Thank you so much. A lot of the questions that are coming up are around sort of defining some of the terms and the things that you talked about in more lay terms. And and you did some of that in a slide towards the end in which you laid out some recommendations. I wonder if folks email you, is there a website or perhaps the content of that brochure that you might be able to share?
Yes, we can share this brochure. It looks better. I don't know what happened with the format.
Yeah,
It's a little
off
bit
and
better.
away.
Make it look a little bit more better, but I don't mind at all. And I
Okay.
think, yeah, I don't mind sharing that at all. So the terms of moderate versus vigorous activity, I think, is something that a lot of people have would like to know the difference more. So that makes sense.
Okay. Well, let me ask you a few of the questions from our audience. There are clearly lots of folks who are very engaged in this work, so I'm going to try and get to as many as possible. So the first question that came in was, how should we use target training heart rate tables? And the person who wrote the question said that they've tried repeatedly to do exercises such as yoga, Pilates, those kinds of things, and have had crises and have had other health problems resulting from those. So she asks, how to use the target training heart rate tables, and then also about weightlifting, whether there are certain machines and certain exercises that she should be focused on.
Right. So for the first question with the target training heart rate tables, that's something that's still under development. So this was only one study that discussed about heart rate and how it was associated with the lactate levels and how that can be a measure of intensity. And the way that they did it in this study was actually they used the exercise testing, so the cardiopulmonary exercise testing has a way to define the association of heart rate and lactate levels in a patient. So it would, if we were trying to repeat this, it would require that someone undergoes maximum exercise testing with having their lactate measured and their heart rate measured for us to know what levels that they should be within. And then the second question is, kind of where we were talking about chronic pain and how pain can be a barrier for exercise, and how exercise for some patients is very helpful, and then in other patients is not. It does make sense that for some people when they exercise, and that's what we saw in our cohort too, is that, exercise might be good for one person, but it might throw someone else into a crisis. So what I would say is to take things very, very slowly. And I think you did some things that, yoga, which is considered to be low intensity, and trying other activities such as walking might be something to do first, and just really do a gradual increase in your intensity. So I would say walk first. And walking is actually considered low intensity. So you don't have to do brisk walking, but walking 10 minutes at a time and see how you feel. Another important thing for patients with sickle cell disease is to make sure that you're hydrated. I didn't show it here, but I looked at the diet of patients with sickle cell disease, and though a lot of our patients are drinking, they're drinking a lot of caffeinated beverages, sugary beverages, which in the end can make you more dehydrated. So making sure that you're drinking about 64 to 96 ounces of water daily can be very helpful. Making sure that you're taking breaks. And also making sure that you're not overly pushing yourself. So it has to be a gradual increase in your intensity over time. And being okay with it taking a longer time for you to gain endurance than other people, but knowing that in the end, that's the best thing to do. Another thing too, if you're having a lot of pain, it's okay not to try to exercise that day. Or if you feel like you're going in a crisis, I also would recommend that you don't exercise that day. All these patients in these exercise studies, they were in steady state, meaning they didn't have a crisis in 4 weeks prior to them completing the exercise testing.
Thank you. That's really helpful. I'm going to sort of combine several different questions that have come in about the type of exercise program, whether or not a program that is supervised by someone, and there's folks are asking about either something that is specifically for people with sickle cell disease, or something like at a gym, a personal trainer, versus a program that you might start at home. I would assume if it was the personal trainer, it would be someone who would need to have some kind of grounding in in sickle cell and what expectations were and those kinds of things. But could you talk a little bit about that, how people might start in some of these different settings?
Right. I think the first thing to know is that, exercise is something that's relatively new in sickle cell disease. And like I said, there's only been 5 studies. So it's something that we really do have to research further. So if you are around an institution that they are doing exercise studies, I would first recommend that you enroll and try to participate in those studies at that point. 2 of the studies that have been done in exercise studies were home-based regimens. And what they included was mainly cycling. So one of the studies in children was only about 10 patients. They had patients actually cycle at home. And then the other study was walking. Those are the exercises that we found that in those home-based regimens that people didn't have crisis for. So that's something that I would say starting off with is just, kind of light aerobic activity and going up further. In terms of getting a trainer, I think you kind of hit it on the head where this trainer would have to be very well versed in sickle cell disease and understanding the complications of sickle cell disease, and understanding that they can't push you. They say, you got 5 more minutes, push it out. You can't do that in sickle cell disease. It has to be more of a graded and slow approach. And that extra, burning it out can cause a lot of pain and crisis down the line. But to sum it all up, right now at this point, we don't have exercise programs widely available for patients with sickle cell disease. And I hope that over, with my research and other colleagues in France and Dr. Liam in Chicago, that we will be able to work towards that. But mainly what the exercise studies that have been done in, and under a trial. This is still an area that is under development. So it's going to be hard for us to answer those questions at this point.
Yeah. Yeah, it really sounds like what we need to be doing is more investigation and exploration around this. A couple of other questions. Do you have a couple minutes to stay online a little bit longer?
Yes.
Okay, we really appreciate it.
Central time, 1:30 Central Time. I'm here. Yeah.
Again, just lots of enthusiasm for this topic. So one of the questions that came in was about avascular necrosis, and with the studies that have been done around people and their particular limitations, how do you avoid confounding with that? And then I kind of had a similar question there, and I think they could probably be answered together. So when I think about doing the investigation that you do with children, and children have had relatively little organ damage, I wondered how much of the challenges with starting an exercise program among children has to do with actual disease pathology, the physiology, and versus being told they shouldn't, which it sounds like is a common thing. And then the same kind of thing with adults. So as you move farther through time, there's more organ damage that happens. And so it's sort of a different interaction. And how do you assess that, the level of organ damage and the level of caution that someone should have around these kinds of programs? That's a long question, sorry.
No, and I think that was a very good question. Your questions are great. So I would say number one, for the inclusion criteria for most of these trials, patients did not have AVN. So again, that kind of excludes some of our patients, a good 20% of our patients, if not more. And many of these studies, including the one that we do too, they're not going to be able to participate in if they have any exercise exclusions based on the American Heart Associations too. So if their pulmonary hypertension is very active and severe, if they've had recent, strokes and things of that nature, these patients are not going to be able to participate. So there is a bias in terms of the patient population that we are using. And then I think the second part of your question was whether or not chronic pain. Can you ask the second part again? I'm sorry.
Yeah, it was just really more, I mean, there's really a continuum among people living with this disease in terms of their fitness level, but also of the underlying organ damage that they may have. And
Right.
how does that get assessed before someone starts a program?
Right. Many of these studies, and I know one in particular, have looked at echocardiograms and they've looked at other traditional kind of cardiovascular risk factors such as BMI, heart rate, lipid levels, and inflammation. So that's how we are assessing it too as well. Of course, again, thinking about the exclusion criteria that I said based on the American Heart Association, somebody has severe heart disease, we're not going to allow them to participate. They were not allowed to participate in the studies that we're doing here at UAB. We're not allowing those individuals to participate as well. But I will say that one study did show that there were some echocardiographic changes for patients who exercised that participated in the exercise program. It increased EF, and I think it also changes some of the parameters in a good way of diastolic dysfunction. Yeah, so that's how we. So there are some of the studies based on how we're designing. We are looking at some of the end organ complications and see if they change with activity or with exercise. Pre and post.
Great. That's really an exciting direction to go in. I will just ask you a combined question about types of exercises that folks might want to do. And we'll have that be the last question. I think it's of particular interest to some of the folks who are still on the line. So there are questions about both engaging in something like a cardio rehab program as a starting point for an adult with sickle cell disease, and whether that would be a good jumping off point. And then also kind of a similar question about using free weights versus weight machines, and whether, you know, doing some weightlifting with low weights would be a good place to start as well.
Yes, I really like the idea of cardio rehab. I think what they've done with rehabilitation for patients with advanced cardiac heart failure and also pulmonary disease is something that that we can mirror in for our patients with sickle cell disease, since they, you know, have a lot of and organ damage too as well, and it can be severe in some of our patients. So I think cardio rehab is great. I think that would be a great starting point for anyone with sickle cell disease to start off as. The differences between, you know, heart failure populations and our populations is, again, the hydration part of it. Most heart failure patients are, you know, their fluid intake is restricted, but knowing for sickle cell disease, you really want to pay attention to your hydration. But cardiac rehab, they do emphasize in, you know, taking breaks, being safe with exercise. Some of the programs are supervised, other of them are home based. So I really do think that that's a good starting off point. And then in terms of resistance training, you know, most of these studies were aerobic. Cycling or walking, they saw that their changes in their muscular physiology occurred. But I will say that we are doing a study here where we're doing resistance training, but again, just thinking about the graduated approach to exercise intensity, we're doing resistance bands. And so I think free weights would be okay. Again, a graduated and slow approach. What resistance training in general, it's always good to have someone nearby that knows what they're doing.
Yeah.
Because a lot of people just in the general population can hurt themselves with resistance training. So, you know, starting off with free weights, low intensity, seeing if there's someone that a trainer, I guess, would be helpful in this regards, that can actually teach you how to properly lift and properly train would be great. As machine exercises are the weight machines in the gym. I'm just a little bit more skeptical about that, again, if there's not proper supervision, because you do have sickle cell disease, and people in the general population are prone to hurt themselves using those machines. Again, I hope that one day we will have more data. We're doing a feasibility trial here where they're doing the resistant band training. So I hope that at the end of this, I can publish this for you guys so that you guys can use this as a guide too as well. But again, this is something that is actively underway, and investigations still need to occur in this field.
Great. And when you're ready to publish it, or when it does come out, please let us know, and we will include that in our updates and newsletters and things like that. That'll be really exciting. Thank you.
Oh, you're welcome.
I will let you take a breath now. I know it's intense to give a presentation like that and then answer so many different questions. Very much appreciated. Thank you.
Right.
And I will let Niani finish things up.
Sure. Thank you all so much to the panelists, and a special thank you to our speaker, Dr. Joy Ogunsile. I wanted to announce before we close, on the screen right now, you'll see all of the many ways that you can find our program and stay connected to us. I also wanted to mention that when we close, there's going to be a brief survey that just asks where you're watching from and what your affiliation is to the work, maybe something you've learned, and if you would like to suggest a speaker for a future presentation, you'll have the opportunity to do so there. So I just wanted to wrap up by thanking everyone who participated and for joining us today. We appreciate you being here, and we will see you next time.
Have you stopped sharing?
I'm stopping the share just now.
Okay. Nope. And I think Dr. Ogunsile and Mary both jumped off, so I won't follow up by saying thank you again. But
okay, great. I'll shoot out an email.